Hello, welcome back, all of you, to a very important session of 3-day APAC HealthTech Innovation Conclave. Right now, we are joined by Mr. Raul Kallo, CEO and founder, Viveo Health. He'll be giving a technology presentation. Is Mr. Raul with us? Hi, Mr. Raul. Can you unmute your mic, please? Yeah. Thank you so much for joining us, Raul. You will be delivering a technology presentation. I was told just to give you an overview that for last 1.5 days, we are discussing on various aspects of technology and innovation for building a future healthcare ecosystem, especially keeping in mind the new world order. And more than 80 plus speakers have joined us and will be joining us by tomorrow. So it's a 3-day conclave happening in virtual platform from various parts of India, healthcare policymakers, healthcare experts, uh, digital transformation leaders from hospital ecosystem, all are part of this conclave. And today also and yesterday also, we had various sessions on various issues related to technology and innovation for healthcare, be it cybersecurity, be it patient outcome, be it delivery, healthcare services to the last mile. So we trying to cover many more aspects of this important subject. With this, it's our honor to welcome Mr. Raul Kallo, CEO and founder of Viveo Health, for joining us for this special presentation. Over to you, Raul.
Thank you so much for having me. And what I will do now, I'm going to share a little bit of our experience from Europe, from around the world, where we went live first in 42 countries about a year ago, and I hope you find it interesting. So, can you see my screen? Just want to confirm.
Yes, yes, yes.
All right. So. I'm based in Tallinn, and then Estonia is world number one in digital health, and then Nordic countries, I would say, is similar, like Silicon Valley in VC funding. A lot of innovation in healthcare is happening here now. So what I want to do today is to talk a little bit about how digital health has developed in the Nordic countries within past 5 years. So if we see, like, digital clinic visits from one of the most digitalized hospital chain in the world, then in 2016 they did only 3,000 digital visits. Now it's almost 500,000. Meaning that, it's also in revenue size, almost 500,000 euro revenues that they do digitally. So it's very, very interesting to see that even those doctors who were not very much tech savvy, now they do a lot of digital visits. But we see there are a lot of partnerships with digital technology providers and public systems in EU countries happening. So we in Viveo Health, we are also talking with Estonian Latvian government to enable to take all to enable everyone telehealth sessions on a government level. So what happened during COVID-19? It's super interesting that me, as one of the members in McKinsey Global Telehealth, Global Technology and Health Technology Roundtable, we started to see how many visits patients wanted to turn to a virtual one. And then about a year ago, when COVID hit the ground in Europe very heavily, then in the beginning, the number of consultations that wanted to go virtual was like 10%. But within a week, 77% of the global population wanted to turn their offline visits to a virtual one. And then obviously now in Estonia, we have a lockdown as well. And then COVID numbers are pretty high. So obviously this lockdown requires immediate change, and then basically physical consultations has been stopped, or regular supply has been stopped in Estonia, and we can only do virtual consultations. So why is it good to have consultations virtually? Is that people can stay in their own home, and there is no risk of infection, and also for the doctors it's the safest way to give consultations. What I would see is very big concern, and we have seen it like many times around the world already, is that these channels that doctors and patients are using for the health consultations are often not secure. Meaning that even in Finland there was a hack to the psychology chain, big hospital, and then about 50,000 patient records were stolen, and then hackers went first against the hospital and then directly towards the patients. So and they obviously asked some money for that. So this is very critical to always use the secure channel and keep patient information really safe. So when we are talking about Viveo Health mission, then our mission is to bring digital health to 1 billion people by 2025. And then I think very interesting is that when I mentioned Estonia is world #1 in e-health, to see a little bit how Estonian e-health has developed. So every Estonian already has a digital health record from 2008. So almost 13 years, and it's public. We have integrations there. Every health advice goes to the national system. So since 2010, we all have e-prescription, meaning that if our doctor is giving out prescription, it will go to the pharmacist digitally, and people can take these medications out only once, because once they go to the pharma, they show a personal identity card, and then take the medication, and then after they can't use the same prescription anymore. So we started with e-consultations between doctors 2012, and then 2019 we first introduced cross-border digital prescription with Finland. But now very clearly what we see is that now every person in the world needs access to the telehealth, access to the digital health. When we are talking about Estonia, then we are talking about the most digital country in the world. And then, funnily enough, we have the biggest number of unicorns per capita. It's all together. In this slide, we can see 5, but just last week we got our 6th unicorn. So in terms of the technology, I think there is a lot that we can share. So Viveo Health team is very international. We have local people in Southeast Asia as well. Comti was the head of Netflix there, and then our India country head is ex-CEO of Novartis and Cipla. But also we have people from Brazil, from Estonia, from UK. So we think that everything that we deliver, we need to have the best people around the world to make it really successful. So when we are talking about Viveo Health, then we've been selected by MasterCard as the only one telehealth company or digital health company where they partner with us to help 1 billion people, and we are already in a good relation with Bill and Melinda Gates Foundation. We're the most promising startup after Bolt in Estonia, and then we are super proud that we were ranked as the best telehealth company out of 3,622 digital health companies. And then how we help doctors and patients. We help doctors to get their practice from offline to online, meaning that they can have a virtual office where they can write prescriptions, they can do video consultations, chat with the patient, collect payments, send to the pharmacy, send to the labs, and also they can do offline bookings. And then how we help patients, it's very, very simple. They can use our app to communicate with the doctor, have our smart payment systems there. They can do these kind of consultations with the doctor, and also they can book offline visits and make pre-payments that enables to cut off all the patient no-shows. So what we noticed when we launched last year, and then we saw doctors from 42 countries starting to use us, was that the technology that we were provided at this time was very complex and something that our own doctors in Estonia were using. And then what we did, we started made phone calls to about 1,000 doctors and asked their feedback, how can we be better? And we understood that we need to be the fastest, most simple and secure platform to scale us big time. So it has taken already 1 year only simplifying and making it the most user-friendly platform in the world. So when I spoke about data privacy and security and compliance, then in Europe, we have this GDPR compliance, which is very, very important. In US, we have HIPAA compliance. For the payments, we have PCI compliance. And then, of course, to handle patient data, for that, we have CE medical device certificate. So what are the key benefits? Definitely, we can be integrated to the hospital systems. So most digitalized hospitals already in the Nordic countries, they like our technology much more than something that they have developed. What we saw is that through the digital platform, health doctors can service like much more patients in 1 hour, and especially via chat. Chat is the fastest way. But for the video consultation, we are also using the best quality, so that the quality is obviously much better than in Zoom, so that doctors can very clearly see, for example, if there is a skin problem or anything like that. So what is our business model and how we work is that we want to be the cheapest provider of technology at the same time. So we only charge very small transaction fee from the patients, similarly like credit card companies and these. So every doctor can go online, register, and start using our technology without paying any subscription. And I think this is very critically important. We want to provide the best technology with the cheapest price. So and we have different partnerships with insurance companies because my background is from insurance. I know a lot about insurance, how to make their business more effective, and then we work with the labs in India, SRL Diagnostics. And some others with pharmacies, course, and we work with the best doctors as well. So how we make this 1 billion challenge possible is that currently we are in 8 countries, but we are opening new countries. We are creating new ecosystems all the time. And then if 600,000 doctors will do one digital health consultation in one day, then in 5 years' time, we have done 1 billion digital health visits. So there are like, I said, 4 main things that make this solution that we have developed the best solution in the world. Is that, of course, first of all, it's the people, and then to have a wide variety of people doing what they do best. So we never compromise with average people. Then solution, I think it's very, very critical. It's that the solution is very, very easy to use, and only that way we can take these doctors who are not very tech savvy from offline to online, and sometimes even cross border. What we noticed in India, that there are top doctors who are having patients from US and both from Europe. Then we are the international platform that is compliant with HIPAA in US, and then also GDPR compliant to service patients in Europe. So the solution is definitely, I'd say, very much key. Something that other providers hasn't done yet, and like you saw, this digital health record, it's very, very critical. It's very much needed, but then like so it happened in Estonia like 2008, so it's already 13 years old. What we do is that on our next phase we are integrating this digital health record with behavioral data that we can collect from the phones, from the rings, from the other gadgets, and if you combine digital health record and behavioral data, then doctors can give so much more accurate, so much more accurate decisions and diagnosis to the patients. And we are really well positioned that we can take these digital technologies that we are developing here and bring it to the world. And like I said, every country is a different ecosystem, different payment systems, different prescription system, different partners. But every country where we enter, we build it up, and we want to partner with the best stakeholders, whether these are hospitals, pharmas, labs, insurance companies, and of course doctors and patients. So feel free to go and look our website and come to me if you want to cooperate, and if you have some questions, we are here to help you. Thanks a lot.
Thank you so much. Thank you so much, Raul Kallo, CEO and founder of Viveo Health, for sharing a very different presentation and kind of impact you're trying to have globally by bringing 1 billion uh, people under your digital health solutions. Quite impressive. And you talked about Estonia. I think Estonia was the first country which pushed digital health records. Also, was the first to move the e-prescription in the world, if I'm not wrong. And we all know kind of innovation being done in the country called Estonia. And I'm sure Viveo Health is taking that legacy forward in terms of providing digital solutions for a better world. Thank you so much, Raul Kallo, for joining us in the
Thank you.
3 APAC HealthTech Innovation Conclave. We'll be in touch. Take care. See you soon. Bye.
Thank you. Bye.
Yeah.